Hello, my name is Felipe Souza, and I am here to discuss with you psychological disorders. Now, what exactly is a psychological disorder? Psychological disorders, as defined by the DSM-V, are mental disorders and a pattern of behavioral or psychological symptoms that cause significant personal distress and impair the ability of a regular person to function in one or more important areas of life. The DSM-V, also known as the Bible of Psychology, describes more than 260 specific psychological disorders, plus numerous additional conditions, like child physical abuse and educational problems, such as children with Asperger's or autism. It also provides specific codes for each disorder, and those codes include the symptoms, the criteria that must be met to make a diagnosis, and the frequency, typical course, and risk factors for each disorder. The book also includes issues related to gender and culture for each disorder. The people who are inflicted by these psychological disorders are actually a grand majority of the population in the world today. About 46 of just American adults will have experienced the symptoms of a psychological disorder sometime in their lives. And the most common disorders, as pictured in the graph to the right, are anxiety, PTSD, and OCD, with a 29% occurrence rate in the United States alone. The mean age for an onset of a disorder is 14 years old, be it substance-induced disorders, impulse control disorders, depressive and bipolar disorders, or any of the anxiety disorders mentioned. Anxiety disorders are the most common types of disorders that exist in the world today. They are characterized by a maladaptive form of anxiety, and the three main traits that determine whether anxiety is pathological or not is it disruptive, or does it interfere with relationships and the daily life of the person afflicted? Is it irrational? Does what caused the onset make sense to other people and to the person who's suffering from it? And is it uncontrollable? Can it be ignored? If not, that is definitely a maladaptive form of anxiety, and the diagnosis should be completed as quickly as possible. Anxiety disorders can manifest themselves as OCD, PTSD, or even generalized anxiety disorder. These disorders in specific are a lot more common in women than they are in men. OCD, or obsessive compulsive disorder, is characterized by ritualistic and repetitive behaviors, intrusive and repetitive thoughts, unsuccessful suppression of impulses and thoughts, compulsions that are unreasonable and have no specific goal. Some examples of this disorder is washing your hands exactly 6 times before you go to sleep, locking and unlocking doors repetitively, turning the lights on and off 30 times before you can actually go to bed and rest in peace. Another anxiety disorder is PTSD, or post-traumatic stress disorder. This disorder is caused by severe mental and physical trauma. Veterans, as seen in the world today, are the population that is most affected by this. These disorders are characterized by unwanted, upsetting memories, such as scenes of war, nightmares, flashbacks, emotional or physical distress due to severe trauma, decreased interest in activities, and exaggerated blame of self or others for causing the trauma. For example, people who suffered abuse or who were sexually assaulted as children are more likely to have this disorder. Now, the last but not least, panic attacks and panic disorders. A panic attack is characterized by a sudden episode of intense anxiety that rapidly escalates in intensity. If several panic attacks occur frequently and unexpectedly, one is diagnosed with panic disorder. Some symptoms of panic attacks and or panic disorder are extreme pressure in the chest, the inability to breathe, and the inability to think straight. Some examples of panic attacks and panic disorders that exist today are any phobias. For example, agoraphobia can be the result of a panic disorder, which means one will not leave their own home because they're scared to interact with the outside world. The fear of spiders, which is a more I guess, common type of panic disorder is also prominent in the world we live in today. Well, that is all for the psychological disorders, and I hope you guys enjoyed the video, and thank you very much for your time.